Hong Kong is scrapping some of its remaining COVID restrictions, including curbs on international arrivals. It follows Beijing's rapid shift away from its zero-tolerance approach. Here to discuss what this all means, then, for the virus and its containment is Sam Fazeli. Sam Fazeli, Director of Research at Bloomberg Intelligence. Sam, thank you for coming on set this morning. I'm just kind of really fascinated by how quickly Beijing has changed tune on COVID zero. I'm messaging with people in the city, and they've all got the virus, having essentially had no exposure to it for the last 3 years. What does that mean for Omicron, if indeed that is the variant that we're seeing rip through China? What does it mean in terms of potential for further variants? What does it mean as China tries to adjust to this new reality?
Yes, so I think we're all baffled by the way that they've gone about it. I think logic doesn't seem to apply here, apart from there's not much else we can do. We've done the best we can. We've got the blueprint of what the West did and what happened, so let's just let it rip, which is what I think is going on. With regards to variants, remember that every time the virus infects a person, jumps to another person, there is likelihood to be some mutation occurring. But we have to be cognizant of the fact that the virus has already had pretty good time to practice on us. And that's what we've done. And I don't think the genomics, the genetics of the Chinese population are that different for suddenly a very different variant to occur. And last point I'd make is that the two most troublesome variants, Delta and Omicron, both came from chronically infected people, not high levels of transmission. So that's something to think about. I doubt there's going to be very significant shift again.
Sam, I think we were hearing from the former deputy of the Chinese CDC, who was basically saying in this first wave, huge wave, around 60% of people could be infected. What does that mean for boosters?
Yeah, so first point, I want to take you back to all the modeling that was done during the takeoff, the takeoff of COVID. They were all wrong. Yeah. Basically, in the end, everybody.
But we have more data now.
Yeah. But basically, everybody gets infected at the end, right? Whether it's 60%, 40%, 70%, it all depends on behaviors. And, the Chinese are better at wearing masks, etc. But in terms of boosters, absolutely needed. You keep hearing this number, 40% of over 80s have had boosters in the US, in China. 3 shots, that is. You need to get that up. So we did a calculation we published this morning that to get to the target that China has by the end of January, 90% of over 80s boosted, 95% of 60 to 79, they need about 95 million shots. And that's 1.5 million per day if you do it every day. The latest data was 44,000 per day. Big push is needed here to get people to roll up their sleeves.
OK, Sam, just very briefly then, given all the caveats around modelling, what are you looking at in terms of potential hospitalisations and deaths then?
Yeah, so you can make a range. I think I've come out with something like 5 million or so.
That's hospitalizations or?
Yeah, because all I did was
deaths?
take... No. Deaths, I was at about 600, 700. Right. But all of that is, I reckon those numbers could be anything from 300 to 2 million. Okay. That's really difficult to pin down because it depends on people's behavior.